Good evening, everyone. My name is Franca Jalloh. I am the founder and executive director of Jallohs Upright Services of North Carolina. We're a local nonprofit organization that serves low-income immigrants and refugees. We help them with immigration legal services, housing assistance, job development, job placements, as well as adult literacy. Clients we serve are oftentimes hidden figures in the community, and we help them in so many ways so that they can be the facilitators that help turn the wheels of what Greensboro needs to make the community go further. We're extremely excited to do this forum entitled COVID-19 in our community to address the outbreak of the 2019 novel coronavirus with a distinguished group of experts. We'll hear from a medical doctor, a congregational nurse, some of our international community leaders, folks from human resources and business expertise background, as well as actual COVID-19 survivors. We'll hear about the community spread of coronavirus, the misinformation, facts and myths about COVID-19, as well as what we can do as a community to limit the community spread, especially during this holiday season. Our goal here today is to keep our community informed, engaged, and safe as best as we can from COVID-19 by bringing the knowledge of these experts so we are better prepared to face it and limit community spreads. Ladies and gentlemen, our distinguished panel includes Dr. Annette Bay with Guilford County Health Department. We also have Ms. Ha Tong from the Martiniere American Organization. We have Ms. Roblyn McNair. She's the Chief Operating Officer at BRS Advisory Services. Mr. Don Lam comes from the Cambodian Cultural Center, and he's representing the Cambodian community. Ms. Teresita Maxey, she's a mental health counselor and a multicultural contract tracer at Mustard Seed Community Health Center. We also have Nurse Debbie Garwood with Cone Health Congregational Nurse Program. We have Ms. Sadiga Ahmed, a Sudanese community leader and a COVID-19 survivor. We also have Pastor Prince Mundeke, a Congolese community leader and a COVID-19 survivor as well. Last but not least, we have Mr. Wilson Lester with Piedmont Business Capital. Welcome, and thank you all so very much for joining us and agreeing to serve as a panelist. I'll begin by asking each of our panelists this particular question. Each one of you have the opportunity to respond as best as you can, given your area of expertise. What would you consider to be some of the greatest barriers facing our community today, particularly?
Okay.
Please mute yourselves.
Facing on your arm.
So that we can hear ourselves speak and we can have a productive meeting. So again, I'll begin by asking each of our panelists this particular question. Given your area of expertise, what would you consider to be some of the greatest barriers our community is facing today, particularly people of color during this COVID-19 pandemic? We'll start first by having Dr. Bay answer this question, and then the rest of the panel will have an opportunity to respond. Thank you. Dr. Bay, you can go ahead and unmute. Thank you.
Hi, good evening. My name is Annette Bay. I'm a physician and I'm the medical director at the Guilford County Department of Public Health. So many of the barriers that minorities and newcomers to the country face are language barriers. Interpreters usually are needed for their interactions with the healthcare system. They also have lack of access to healthcare because they may not have insurance. They may not have trust of the system, so they may be afraid to use health centers, and they may feel that it's some type of immigration trap, so they may not go to health centers. And in addition, because of their avoidance of healthcare systems, they have underlying chronic medical conditions which may not have been treated. So that's another barrier for them. And again, there's a lot of stigma and discrimination and not only for immigrant populations, but for other minorities who have not had good experience with the healthcare system. They've sometimes may have felt disrespected, not taken seriously. And so with those kinds of feelings, you would be reluctant to seek out healthcare under those kinds of circumstances.
Thank you so much, Dr. Bay. Thank you for answering that question so well. I'll go ahead and proceed with asking anyone else from our panel, maybe Roblin or Har or Sadiga might feel like answering this question. Would you like for me to repeat it, or do you remember?
We remember it. I can go ahead. My name, good evening, everybody. Peace upon all of you. My name is Sadiqa Ahmed. I am originally from Sudan. I am the chair of the International Advisory Committee, and I am a counselor, and I am the director of new nonprofit organization called Giving Hands. I want to thank my sister and friend, the director of Jallohs Upright Service of North Carolina, for hosting this very important event, which it will gonna be benefiting our communities during this difficult time. I don't have like different answer from the doctor. What she said is the language barrier and the lack of insurance, especially among newcomers, all international communities and all the minorities, but newcomers, it is hard for them to navigate the health system. Also the lack of insurance and effect and of misleading information about virus and the method of curing, preventing them from getting the right treatment.
Thank you very much, Sadiga.
You're welcome.
Thank you for addressing that question for us. Would Roblin or anyone else like to respond, or Dawn?
Hi, Franca. Yes, my name is Roblin McNair. I am the president and chief people advisor for BRS Advisory Services. We work with small to mid-sized companies with their human resources. And what I would share would be a barrier to the immigrant workforce in terms of with coronavirus is that them having access and feeling comfortable in going to seek help. And oftentimes they're living in close communities with their other family members, and they're not able to do the social distancing and those types of things. And also that prevents them from being able to, if they don't go to work, they're generally working in positions where they have high exposure in most cases, and they oftentimes don't have an opportunity to work from home. So that puts them at greater risk because of that, because of the types of works and the jobs, the positions that they have, and also living in close proximity to other family members who may, not feel comfortable to go in and seek help and to receive testing for, fear of being, deported or something of that nature, or just not have access to those resources.
Exactly. These are some of the barriers that we face. And I'm glad you guys are so articulate in responding and giving us that adequate answer, especially when it comes to people of color, particularly the immigrant and refugee community. I will go on to the next question. I'm not sure if Ms. Teresita is on the line right now. It's on this meeting. I believe she was running late. I'm not sure if she's on now. Okay, so we'll skip that. And I'm going to talk to, we're going to head on to Wilson Lester and Ms. Roblin. The media reports that the economic consequences of the COVID-19 pandemic has devastated the world, and it's compared to that of the Great Depression. It is said that the labor markets, the retail stores, tourism, mass manufacturing, such as the factories that many of our community members work at, was greatly hit by the pandemic. The bigger impact of closures of schools, daycares, with over 15 million single moms in the US now that have to stay home to care for their children, meaning that these families are now left without a source of income. Based on your professional opinion and your professional expertise, In what ways has the COVID-19 pandemic impacted our business community in Greensboro and North Carolina? And what are some of the concerns economically, as well as, in terms of families, that you want to bring to light in regards to the recent COVID-19, the rise of COVID-19? Thank you.
Franca, thank you for your question, and thank you for hosting this panel this evening. We're in a very unique place right now. The pandemic has really left small business reeling, and the future of small business reeling, because there's still a lot of uncertainty. Even tonight in the state of North Carolina, a statewide mandate goes into effect that determines that businesses that are open after 10 p.m. must be closed by 10 p.m. due to the recent increases in COVID-19 outbreak across the state and across the country. But this virus has essentially swept away, for the Black population of America, 41% of their businesses, and we're seeing reports that similar activity has happened in the state of North Carolina itself. So if you'd imagine this for a marginalized community that is historically marginalized in our culture and in our society, you can only imagine that this impact is even far greater for immigrant-owned businesses in our international community. When PPP and a lot of these services and items rolled out, they rolled out to folks that had the most relationships, had deep relationships with their bankers, had deep relationships with lawyers and folks that were very in tune with the information that was going to come down to provide relief. And those businesses got to take advantage of that resource first. And then the other communities that were on the peripheral, or even harder to reach for those resources, finally opened up legislation and regulation to allow capital to more easily flow into those businesses, but still often too late and still not reaching the immigrant community in a way that could be impactful. We're extremely concerned about what the future holds. We look at what happened in the Great Recession in 2008, 2009. More than 50% of African American and minority populations lost their personal wealth at that time, and we have yet to see what the complete fallout is from the 2020 events that have been caused by this global health pandemic. So I think that we have a lot of work to do, and we have a lot of awareness to create. And forums like this, for those of us that are fighting on the economic side to create greater opportunities and pathways for small businesses to survive, any information that we can gather or share about the experience and what the needs are can better help inform those of us that have access to capital or relations with pipelines of capital to inform how it can come down to be effective for the international community here in Greensboro.
Thank you so very much. Thank you, Wilson. Roblin, I think this is also your area. I was wondering, in terms of the HR perspective, what do you think, how has COVID-19 affected the community, given the economic status we're currently in and what it was prior?
Right. And I think just as the prior panelists indicated, it has, had a traumatic effect because, as I said before, especially if you have single parents that are not able to work from home and they are living in multi-generational households, it has, had a significant effect on them and their ability to find adequate work. And then if they do find work, then they'll have, they have the childcare, the issue with childcare and virtual learning and all of those various different components that has had a significant impact, and it continues to have an impact on the resources that are available and also how they're able to adequately prepare for, their families and those other types of things that they would need to carry on their daily functions. So it continues to be, a major concern and a crisis, and looking for ways to help and support in that area. So collectively as a community, identifying opportunities to find jobs and training when those opportunities are available.
Thank you so much, Roblin. We appreciate your response to that question. Before I move on to my next question, please allow me to.
Thank you.
Liana, if you could please. So please allow me to introduce our board chair, Madam Milagros Amaro. She will go over data and explain what Guilford County Health Department data on COVID-19 is about and what it looks like today. Milagros, welcome. And you, I believe you have a screen to share with us. Please go ahead. Thank you.
انت هنا تتكلم انا عليك تشوفها.
Let's give her a minute.
Before Milagros proceeds, can Zoom someone that is mute their phone? Anyone that is not speaking right now, if you can mute your phone so that we won't have any interruption.
Very much, Manta.
Okay. Okay.
لا ده كله بعرف احسن منه. You know what? والله يا احمد جرب هنا جري.
Can everyone see my slide?
Nawal عمل mute.
I'm sorry.
Mute everybody so you only you allow those who are presenting to
I am doing that right now as we speak.
Okay.
Go ahead, Milagros. Thank you so much.
Okay. As of today, December the 10th, Guilford County Division of Public Health has confirmed a total of 17,496 cases of COVID-19 and 268 deaths in Guilford County. Thus far, there has been 1,018 hospitalizations and at least 15,157 recoveries to date. Now, in doing some tracking, we went by the zip codes. And what I did was I provided the zip codes of our clients based on their accessing our services. So we have zip code 27405, 27408, 27407, 27409, and 27410. Now, this was last month, okay? The lighter color is just mild cases. As it gets darker is where the prevalence is higher, as you can see. So right here is only concentrated on 27410, 09, 07, 08, and 05. However, here's a more detailed map as for this month as of today. And as you can see now, we even went even deeper to where we have households where one or more parents were born outside of the United States. And that can include your immigrant, your migrant families, and your undocumented. Now, where you have the lighter colors, 2708 and 27401, that's lower transmission cases here. But then if you could see my chart right here, as the colors get darker, that's where we have the higher transmission. So if you can see, 2705 has a high prevalence, 27410, 27407. Here, the lighter ones is a moderate. Now, the numbers here, it will calculate the amount of families, the total families that have maybe one or two parents that are head of households that are either immigrant, refugee, or migrant worker. Based on this, you can tell that where the higher prevalence is because they're not getting tested enough. They're not coming out. Even after they're tested positive, they're not coming to get treated. and just the transmission is just increasing. And we must do something to try to lower these numbers, because this is very serious, especially in the immigrant, refugee, and migrant communities.
Thank you so much, Milagros. So on that note, why do you believe so many immigrants and refugees fall through the cracks and are not coming forward to be tested for COVID-19 and continuum of care?
Okay.
I also like to have Dawn, Sadiga, and Pastor Prince to think about this question as well. Go ahead, Milagros. Why do you think that many immigrants and refugees fall through the cracks and are not coming forward to be tested for COVID-19?
Okay, I'm going to piggyback onto what Dr. Bay said. You know, there's a lot of stigma with regards to with the COVID-19, the virus, how it came about, and then is this test very effective, or is it giving out false positives? Then you have to see that the ones that just have a one-parent household, if they have to go to work and they test positive, how are they going to support their household if they have to stay quarantined for 14 days? Now it's like 10 days, it's been lowered down to 10 days. There's a lot of factors that take into account. And my experience with doing the COVID testing, where I had done outreach out into the Hispanic community, for example, here I am thinking that I'm going to get at least 50 or 100 to come and get tested. I got 4. It was very disappointing. But what's happening here is that one person gets tested, they come up positive, or they wind up being in the hospital, they stayed, got treated, were given meds to bring with them to come home. How about they sharing the meds with other family members to avoid getting sick? That's the mindset. Others are that if they're not documented, of course, they're thinking that every time that we're doing testing, oh, if I go to the health department, I bet you they're gonna have ICE over there. Somebody's gonna be looking out for us. And that's not only with the Hispanic community, because you have a lot of refugees who have not gone and finished doing their immigration papers. So they're falling on the cracks to where now they're not documented. They came in as refugees or they came in as parolees. They let the time slip because they were working, never had time to go out and take care of that paperwork. So now they're here illegally. So if we just give the word out, it has to be that we have to make it to where they're comfortable. We have to speak clearly, and we have to be like an open book for them to be comfortable enough to come and access services. And it's not only services within the health department, they could go to their community clinics. There's many outlets that they can go to.
Thank you, Milagros. Thank you. I'll move on. Sadiga Ahmed or Pastor Prince. And if you'd like to take this question.
Yes, because most of them see it is as stigma and shame, like what they said, and also they fear the isolation from their own communities, because some of the people from the community think if you get affected with COVID-19, you will be contaminated for a long time after the 15 days. And people stop interact with you and fear your company. Some of them don't want to stop their work because they fear of losing their job, or they fear that they cannot have any type of financial support. Thank you.
Thank you so much.
Hi, Frankie. This is John. This is John from Cambodian Culture Center. Thank you for putting on this this panelist again, and I'm here representing our board member, with our president, Mr. Dara Yun, and our chief operations director, Mr. Seha, and lots of our board member, which you already know, Vandi Sochit, and a few others. I think to answer your questions of why our immigrant or people of color communities might be falling through the crack. I think number one in the Cambodian community, from what I can observe, is like first of all it's the message that we get from the top down, the denial of the science and the facts by top political leaders, which brings a lot of doubt into the community about like the seriousness of the disease or the virus. But it also comes down to like leadership within our immediate community. What I've noticed is that within our community, within our board members, I believe we do a pretty good job of setting examples through our leadership. So when we are affected by it, we have a good relationship with our community members. We share, where the testing centers might be. And so when members of our communities are affected by it, and if they're comfortable sharing, we also share that information so that the information gets passed on to other members, which creates more trust within our community and allows them to say, oh, it's not super negative. It's not a stigmatization that I have to be concerned about because, other members of my community have gone through it and, they know what to do and I can reach out to them. And that is one thing that we try to encourage within our community and within, the leadership team of the Cambodian Culture Center and the temple, wherever we go, we always, encourage our community members to get, the correct information and to get checked and give them brochures about where, all these resources are, and then welcome them to ask questions and to call us up when they need additional information. And it just really comes back to us being open and leading through, through examples of saying, hey, it's okay to be uncomfortable, but we as the community are together in this. And if you have questions, we have like businesses that are can help within our community. We have business members and then we have employees, so we can connect from business to business. If if some business are having questions, that we can connect them to other small businesses. And I want to go back also to the point of how much our communities are impacted by the closing of businesses within our community. Mostly in immigrant communities, really tight-knit connection and really tight-knit dependency between businesses and employees, because sometimes most of our employers are people that we know, their employees and employees are people within the same community. So when businesses might close down or we have to not open business for a while, that affects everybody, not just the employee, but the employers, also the sources of help that gets through this business sponsorships that get through to community centers, because who are all business sponsors when we're in a community like small communities like ours, like Cambodian Culture Center, or other communities here. It's the business members that are within our community. So it affects every one of us, and it affects nonprofits largely a lot as well. Yeah.
Thank you so much, Don. I think that was pretty well said. It comes down to leadership. It comes down to who we look at for support and guidance. And I believe that has a huge factor in how our community responds to COVID-19 and also the vaccine. So thank you so much for pointing that out. I will yield to Pastor Prince from the Congolese community. Would you like to take on that question as well?
Thank you so much. My name is Pastor Prince. I'm the pastor of David Church, and I'm also a leader in the Congolese community. I'm representing refugees from East Africa and DR Congo. Right now, I'm in New York City. I came to visit a family. So the way I see people here in New York are looking after the COVID-19, realize that the North Carolina, especially in Greensboro, maybe we are behind. Because when I arrived at the airport, also the military. So you have to fill a lot of papers. You have to pass through the scanners. So I realized that these people are taking serious the pandemic. As a survivor of coronavirus, I can say that there is a problem in our community. People don't really understand the pandemic, the danger we are facing, and the majority of people in our community, most of them are like misinterpreted the COVID-19. We are in a situation whereby we need to intervene, because if we don't intervene, I believe that many people in my community will be in danger, and also will get others in danger. First of all, in my community, wearing masks is a problem, because there are some religious interpretation whereby people are taking coronavirus like a devil. So they are receiving a lot of false prophecies, false messages. So if you wear a mask in front of the people you're leading, they'll think that as a leader you don't have faith. I remember today I posted something on Facebook about the COVID-19. I was saying that we should wear a mask, but some people inboxed me saying, "Hey, Pastor, you are not supposed to say that. You don't supposed to spread the fear in the members of the community." Now, the only thing I think what the refugee agencies are doing is good, sending videos, but you have people in a community that they don't open videos. The best way will be it will be possible. We can go even door to door, talk to these people about the danger of COVID-19, because there is a problem of awareness. People don't realize the danger of the COVID-19. Secondly, many refugees, when they came here in America, after 3 months, they found themselves working in companies. So most of them, they never see a doctor, family doctor. Maybe they introduce them once to the family doctor, but they don't know how to start, especially meet with a family yesterday, and they're telling me they don't know their family doctor. When you try to call the clinic, they say they are not the client, the patient in that clinic. So most of members in our community are fearing to get tested, because they know if we get tested, they will quarantine us. So if they quarantine us, we will lose the money we are receiving. How are we going to pay the rent? How are we going to pay the bills? So there are economic questions that are coming every day. And as the community, we don't have a much response to give to members in our community. We're trying to mobilize, but I think the states has to think how they can finance the organization that are dealing with the refugees, so that maybe we can go to refugees and immigrants and talk to them about the situation that the city is facing right now. Thank you.
Thank you so much. Thank you. And I think you hit the nail on the head. Understanding, lack of understanding is a big factor. And that comes down to myths, that comes down to misinformation in our community that's being spread all over, telling us one thing versus the other. And so we need to hear, actually, what really this is about. So on that note, I'm going to ask maybe Ha or Dr. Bay, what are some of the COVID-19 facts or myths that has become a rising issue in our society? These things are causing so much complications and making COVID-19 coronavirus much more, deadlier than it should be, because of the myths, because of the misinformation. Do you care to address this for us, Dr. Bay or Ha Tong? Or if mental health, someone with a mental health background, I think Teresita is not yet on the line. She was having technical difficulties. please go ahead and address this issue.
This is Dr. Bay again, the medical director from the Guilford County Department of Public Health. Thank you for having me. To address some of the things that you mentioned, there is a lack of the correct information concerning the virus. And when we have this idea that certain segments of populations won't be affected by it, or that if they do certain kind of home remedies, that will treat the virus. So the virus, there is no treatment that we know of at this time for COVID-19. What we are looking forward to is to have a vaccine that would confer some immunity to becoming infected. But even with the vaccine, we will still run into concerns because of myths and misunderstandings about the safety and efficacy of the vaccine. So the same way we have those kinds of myths about the vaccine, and we'll probably discuss that a little later, there are still myths that surround the coronavirus. And we see that some people feel that they don't need to wear a mask because they feel that they won't get infected. There are over 50% of people who do come down with the virus, they are asymptomatic. So they don't even have symptoms of the virus, and they are shedding and spreading the virus and affecting other people. Some people feel that if they're young, they don't have to worry about it. This is of concern because most people who are infected with the virus will have mild symptoms, but people who are have medical problems, chronic medical problems, we see that they are more severely affected when they become infected with coronavirus. And we look at the communities who are disproportionately represented with chronic illnesses. We come full circle back to minority communities. We come back to immigrant communities. And so these are the communities that will be severely affected if they are infected with the coronavirus. And the other thing that I wanted to comment on is that testing alone is not the silver bullet. We want people to get tested, but we also want people to wear masks. We want people to understand about social distancing and social distance. And we want people to frequently hand sanitize and wash your hands. But when we talk about the vulnerable populations, sometimes living in multi-generational housing makes it difficult for you to social distance. When we talk about having the ability to work from home, many people who are essential workers and come down with the COVID virus did not have the luxury of working from home. And so that's why we see the essential workers are disproportionately represented by our vulnerable and marginalized populations. So that's why we see higher levels of infection with these populations. So every coronavirus does not discriminate. So if people feel that they will not be affected by the virus because of certain circumstances that they may have personally, it's not true. Everyone can be affected by the virus, but depending on your immune system, depending on your associated risk factors, which I mentioned, that will determine how severely you are affected by the virus.
Thank you so much, Dr. Bay. I think you've actually gone ahead and given a lot of the reasons why people are so skeptical or so, they are spreading a lot of information that may not be correct because of the fear of COVID-19, their fear of COVID-19. Ha Tong from the Martiniere community, would you like to answer this question as well?
Can you repeat the question? Sorry, I just switched from my laptop to my phone, so I missed the whole thing earlier.
That's okay, sure. Thank you for coming back, for joining us back. The question was, what are some of the COVID-19 facts or myths that has become a rising issue in our society? What are some of the complications that are causing the rise of COVID-19 in our communities today, basically?
Thank you. I think some of the complications that affect the rise of COVID-19 would be the language barriers. Going back to your first questions, this is from my own experience of working with the Martiniere community. And COVID-19 does not only affect like one individual's physical health, it also affects other aspects of life, like education, employment, housing, and mental health too. And with immigrants community, a lot of them do not understand English to the level that they could comprehend the essential information on COVID-19 in general, and also on how to protect themselves, how to come about treatment, and ask for resources, stuff like that. Somehow these people have to be self-sufficient in like calling or contacting certain people, for example, community health worker like Liana and I, and trying to do things virtually, following new rules, regulation, etc. However, this process has not always been easy. And so many of them actually fail to be self-sufficient, and it is not because of their fault, but because of their own background, of the background that they come from. Compared to other populations, finding testing site or getting test results or getting letter to go back to work, etc., may be very, very easy, but for immigrants community, these tasks may be very hard to do.
Thank you so much, Ha. We have 2 COVID-19 survivors here today. We thank God that they're alive today. They went through COVID-19 and along with their families, and they're safe, and they're with us on the Zoom meeting today. I would like to ask Pastor Prince and Sadiga, what does it feel like to actually have the virus? We've heard so many stories. We've seen so many, videos of people with different types of experience. We just wanted to know, what was your experience like, and what advice would you like to give anyone who is going to be going through, we're likely to catch it, who will be going through this same episode one day?
Thank you so much. Yeah. What I can say about it, first of all, everybody reacts to COVID-19 differently. In my case, we all had COVID-19 in the family. So the way I've been feeling was different from the way my wife was feeling, or the way my sister daughter was feeling. But the only thing I can say about COVID-19 is something that I can't really want somebody else to get it, because the time you get it, you start feeling like death is near your door, and there is no guarantee to survive. There is no guarantee to survive. You feel like maybe you are dying in the next minute, especially when you start developing the symptoms, because all of us in the family, we develop the symptoms. But I thank God about the community, because we have a community that people, I remember our director of the Congolese community, Sifa. He was doing everything to come to us and make sure that we have everything we need. What I can say about the COVID-19 again is people should understand that it's a sickness like other sickness, and sometimes it's not shame to have COVID-19. If you feel like you have some symptoms, you better go test, because once you test, you start knowing for sure that you are a danger to the community, and you also a danger to some people in your family. So, but if you don't test, you'll be like give it to other people. The experience of I went through, I can't really want someone else to pass through that experience. That's why I wear a mask whenever I go somewhere, and also I avoid to get again the virus, because it was painful. It was painful. I remember my wife crying like a baby. My sister was crying there. So it is a bad experience that I went through in my life. Thank you.
I am so sorry you had to go through all of that. I am so sorry. And thank you so much for sharing your experience with us today. Sadiga, you are also a COVID-19 survivor. We say Alhamdulillah. We say thank you so much for being with us here today to share your experience. And hopefully people can learn from that and do better, or be able to take care of themselves more after they listen to you. Sadiga, do you mind sharing your experience with us, please?
Yes, yes. I get the virus on June, and some people, they said they will feel weak and they feel their body ache and stuff like that. When I had the virus, I didn't have anything. I feel like just my throat, like any flu or something. I feel it about 5 o'clock, and everything that's coming like bum, 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 bum. I felt my throat hurting, and then I feel runny nose at night at 9 o'clock, fever, and I have a headache. And I don't know, from the beginning, I said I had COVID. And my family, they said, no, this is not COVID. I said I had COVID. And for the people who knows malaria, because I came from Africa, I think all of Africa know what malaria feels and what malaria like. This is like malaria. And I have the body ache and headache and fever, but it is not like very hard. I have the fever for 2 days or something, but the body ache and nausea and all of this stuff, it is with me for like 2 weeks. And the most important that I want to say to everybody, don't scare from this virus. The very important that you have to be relaxed, and you have to know that this virus will never kill you unless your time is end. If you have any remaining time, you will gonna end it. Nobody, you can get killed with COVID or without COVID. So you just have to put in your mind, when you have COVID, that doesn't mean you will gonna die. So, and some people, they said the virus is weak, the virus is man-made, stuff like that. The virus is not weak, but the immune system is different from person to person. So the people who have a good immune system will fight it, and some people, they never have symptoms. Like my kids, I just quarantined them with me, and when I took them to the test, they tested positive. But they have no symptoms. If they went out, they can affect other people, because nobody will realize that they have COVID. So be careful, because some people, they just go and interact normally with people, and you see them as normal, but they are not, because it is different from person to person. And the mental health, it is very important in this virus. If you have the support, if you have if you feel like you're gonna fight this virus, you're gonna be you're gonna fight it, and your immune system will gonna be strong. But if you thought about, no, this is my end of this is the end of my life, I'm not gonna be cured from this virus. And even if somebody in the family, they just isolate you very aggressive, like they can't talk to you and they are not take care of you, this will affect you to be cured. So please, if somebody or you in the family, give them the support that they need, because this is very important. And the support and care is the one that will help you be feel better every day, and you're gonna get well from this virus. Thank you.
Thank you so much, Sadiga. I think you kind of elevated a lot of people's concerns and fears. We believe that, COVID-19 is a death sentence. You kind of, address some of those issues for us and give us an adequate answer in terms of what it feels like. And also we think that COVID-19, it is, there's a stigma of, oh my God, if I caught COVID-19, what does that mean in our community? People are ashamed of it. There's that shame factor that comes with this virus. And I'm so grateful that you, Sadiga, and Pastor Prince, were brave enough to come out today and speak about it, because any one of us could catch, we could get infected with COVID-19, and it is okay. It is absolutely okay. You just have to care for yourself. And as Sadiga says, the mental health factor is extremely important for us to get through this, get over this. Having the right support system. Both Sadiga and Pastor Prince mentioned that the community was there during their ordeal, and that's how they were able to come out of this successfully. So community support is extremely important as well. Now I'll move on to Roblin. Roblin has an HR background, and the question I have for Roblin today is in regards to what rights people have once they're tested with COVID-19, what rights they have in their workplace, with their jobs, so that they are able to take care of their families or go get tested and not continue walking around with the virus with no treatment and contaminating more people. Roblin, if you could respond to that for me, I'll really appreciate it. Thank you.
Okay. Yes. Thank you, Franca, for the opportunity. And well, for that, the CARES Act has been put in place where it provides 2 weeks of paid sick leave for individuals who have to either seek testing or have been asked to quarantine, or have, need to be out of work because, they have a positive test or even waiting on test results. But 2 weeks is generally not enough time. I mean, in the event that, if you're waiting for results and you can't work until you receive those results, and then if you have family members that are also that you're caring for, the CARES Act does provide for leave for that too. But in some cases, the leave is unpaid leave, where it actually will protect your job, but not necessarily pay you for the time that you're out. If you're, caring for a family member who has, contracted the coronavirus, or even if your children are in a situation where they don't have childcare. So there's a 2-week period where employees can receive 100% of their compensation. But thereafter, there aren't any other sources available for them unless they would like to utilize any paid time off benefits or other leave benefits that may be available for with their employer. So in some cases it's limited, and it just really depends on what the circumstances are and who is actually affected with the virus and what those implications are. And if you think about it, if a person has to be hospitalized, In some cases, it's more than 2 weeks. And they would have to, if they don't have health insurance, then they would be in a situation where, they would have to take care of their care, but then also not be compensated beyond that 2-week period for being out of work. And then not only that, oftentimes they're supporting other family members, the households as well. So that lack of income coming into the household can, have a disproportionate effect on their household as well. So those are just some key areas in terms of what those effects could be. And then also, unemployment is another option, but that has a limited time frame as well. So we'll continue to just continue to look for other options and resources that are available to help combat this virus and the effect it is having on the community as a whole.
Thank you so much, Roblene. I think that's one of the biggest concerns people have. What will happen to me if I get this virus? And how can I support my family and care for them throughout my illness, the time that I'm unable to work? And I think that's one of the things that a lot of our community members are fearful of, and probably one of the reasons why they do not necessarily want to go get tested. So thanks for letting us know what our rights are and what people are entitled to based on your background in the HR field.
Sure, thank you.
You're welcome. Dr. Bay, given your expertise as a medical doctor at Guilford County Hospital, when comparing immigrants to other populations, has the virus experience been more difficult on immigrants, or do you believe we are all together in this and that it has hit hard on everyone, notwithstanding one's race, ethnicity, religious background, and so on and so forth? You just need to unmute, Dr. Bay.
Hi, my mute and unmute button keeps dancing around. So as I mentioned before, the virus does not discriminate. So right now we're seeing that there is active and ongoing infection across the country. North Carolina, every day we see the number of positive patients going up in the communities, and that was what was behind the stay-home order. So what the coronavirus is an equal opportunity virus. So you will be affected by it depending on your own personal situation. And in terms of if you are infected, do you have other underlying medical conditions? And if you do, we have seen that the people who have the underlying medical conditions are more severely affected when they become infected. And so that's why we want to do as many things as we can, layer upon layer of activities to protect us from becoming infected. And that's behind the 3 W's. Washing your hands, wearing a face mask. And sometimes the face mask, when we think about it, is really protecting that other person from being infected, because there is a large percentage of people who are asymptomatic, meaning they don't have symptoms, but they are infected and they're spreading the virus. So we all will have an opportunity to be affected or infected by the COVID virus. So what we need to do are remember our layers that we put in for source control. And that means that the 3 W's are very, very important. Take this virus seriously. You can become infected. Make a plan for the possibility that you will be infected. Be prepared, be proactive in your in your daily living activities, because there is a possibility that you will unfortunately become infected. So we do all those things that we can as individuals, because again, your response, if you do become infected, depends on your own healthiness. So your immune system, if you have a healthy immune system, that is the system that takes on any virus when we have a viral infection. It's not like a bacterial infection where we can give you antibiotics and you get better. Viruses are predominantly dealt with in our bodies by our immune system. So keep your immune system healthy. That means if you, with everything else that's going on in your life, make sure you eat well, healthy, nutritious meals, sleep well. If you do have medical problems, reach out to the resources that can take care of you. If you have insurance, if you don't have insurance, there is a community health center, which has sliding fee scales to help individuals who don't have insurance to have their healthcare taken care of. So if you have chronic illnesses like a diabetes, if you have hypertension or you have chronic lung disease, make sure those medical conditions are stable, that you're taking care of them, taking medications as you should. And try to get the correct information concerning this virus, because there's a lot of misinformation out there. And we in the healthcare system, we are given particular treatments and medications to treat conditions that exist, so that some people won't have to die from being infected with the virus. Because as we see across this country, over 280,000 people have perished at the hands of coronavirus. So it's a very serious virus. It's a very serious illness, and we really need to respect it as such, and do as much as we can to stay safe. Wear your mask, wash your hands, and keep your distance 6 feet apart.
Thank you, actually, Dr. Bay. It looks like you read my mind. The next question was actually going to be solutions. You know, if you or any member of the panel can offer creative solutions on how we could be able to get over this COVID-19 crisis, especially during this holiday season. With Christmas right around the corner, what should people do to protect themselves and their families? And you just kind of gave, you know, in a nutshell, some of the creative ideas that would help us deal with it. I'm not sure if any other member of the panel would like to respond to that briefly without having to repeat what Dr. Bay said. We would like for people today to take home ideas on how can they keep themselves and their families safe. What creative solutions would you have to offer before we move on to asking our audience to, then our audience can get involved and actually ask the panelists some questions as well. So any of the panelists offer solutions?
Franca, can I just add to what the doctor said about if our community has been affected very hard, the international community has been affected differently from other communities. Can I add to that? I'm just briefly.
Yes, please.
So because yes, our community, international community are hit very hard because we are in our nature and in our culture, we are very connected. And also we are connected because due to the isolation, from home country, from the large family support we find over there. We found ourselves over here are more connected to fill the gap that we feel warm of families when we connected over here. When the pandemic came, the isolation, the situation changed. And the international community found themselves alone and far from home also, and far from family support. And that's why they never listen to health professional and guidelines, and they live their life normal. And even some of them that denied the presence of COVID-19. And some suffer as the isolation because they never used to this kind of situation. So that's why they get hit very hard by this pandemic. And we find now many families have been infected with this virus. Thank you so much.
Thank you so much, Sadiga. We
Can
appreciate.
I just mention one other thing? And I agree with the speaker. And so because cultures are accustomed to being together and gathering together, as much as you can try to social distance, as much as you can do activities outside, do activities in well-ventilated areas, wear your mask. People have created little bubbles, and people who live in the same bubble, they're probably at more likely not to expose each other. So we can't create bubbles in communities where we do gather a lot. So if we're gathering, try to keep space, keep distance, do the gathering outside, and just try to decrease the amount of people that are gathering in groups. Particularly wear masks. That's a big thing. Wear your mask unless you're eating or drinking or sleeping. And so understand that even for the residents of the United States, it's been very difficult for them to accept a new normal. Does that make sense? So we're going to have to accept that new normal. And what's in the future for us is hopefully the vaccine has looked very promising. And if when it's approved and starting to be allocated, all communities have to make themselves knowledgeable about the vaccine and get on board to be vaccinated. That's helpful. And the other thing is helpful to get your flu vaccine right now, because if you have flu on top of COVID, that is not a good situation health wise. So those were the kinds of things that I would recommend. I cannot trump, I hate to use that word, culture, but trying to be sensitive to culture and try to integrate culture in ways that you can still protect yourself, because the kinds of activities, gathering, not wearing masks, those are the situations that will make the coronavirus flourish. It will, like wildfire, go through communities that are congregate, they get together, they don't wear masks, and they're not washing hands. So people getting together, use plastic utensils that you can throw away, a lot of hand washing, a lot of mask wearing on top of those, on top of all of that during this time. And hopefully those are just mitigation activities. Nothing is fail safe, but try to do those kinds of activities to keep us all safe, keep your family safe.
Thank you so very much, Dr. Bay. We definitely appreciate the advice as we approach the holiday season, Christmas, and so on. We definitely need to keep all our families safe. So thank you for that wonderful advice from Sadiga as well. I think both of you responded adequately to that question. Finally, I would like to pose this question to one of our board members, our distinguished board members, Fanta Dolly. She recently went about getting tested and making a video that we shared on Facebook, on Instagram, and so on and so forth. She took the time to get tested herself and make a video. I wanted to ask Fanta, how does one go about getting tested for COVID-19? And what was your experience like in a nutshell? So people who did not have the opportunity to watch that video will understand what it was like and not be afraid of going to go get tested. Please, Fanta, if you could unmute yourself and address that question for me. Thank you.
Thank you, Franca. I really appreciate it. Um, just being unafraid to go get tested was the biggest thing. I I tried to stay away from it as long as I could. But then I work on a university campus, and when I started getting emails about positive cases that were on campus, I definitely wanted to make sure that I got tested. And the reason being is because someone mentioned it a little earlier. You can be walking around with COVID, have no symptoms at all, and you're still passing it along. I don't want to be responsible for making someone else sick because my immune system and their immune system are totally different. So how their bodies react to it may be fatal as opposed to mine having low symptoms. So I don't want their blood to be on my hands to say that I could have prevented someone from getting sick by simply getting tested. So, as with everything, you have all of these different myths of what's going on. You know, they poke it up so far it bleeds your brain stem, and you'll be choking on it, and it's just different things that is out there to deter people from getting the test. But I'm here to tell you, I went in and got tested and was shocked that, first of all, it didn't hurt. Second of all, it didn't take long at all. I was in and out in about 5 minutes. So you go in and you, of course, like with any doctor's appointment, you give your information so that your test results can be linked directly to you. Now, I know there's all these things about tracking and things like that, rightfully so. You can be in a grocery store or in a meeting with someone and they have tested positive, but they don't have to tell anyone. And then you wonder, where did I get it from? And the tracking is able to help you with that. And there are so many different places right now that are doing testing because Cone Health has made it possible for mobile units to be dispatched out to community centers, to different churches, different locations. And you can find that on the Guilford County Health Department website. And the thing that people shy away from also is the cost of it. A lot of these places are giving free testing. If you do have the other places that are charging, if you do have insurance, they are charging it to that. So you don't have to pay. I think it's like $25. But what is $25 versus your life? So I definitely guarantee that it is worth it. And it is a short 5 minutes that you can take to not only save your life, but save the life of the people around you.
Thank you so very much, Fanta. I appreciate you sharing your experience with us today. And I bet that, a lot of members of our community will now go ahead and get tested with Cone Health or with Guilford County Health Department. Thanks for sharing your experience. Milagros, would you like to add in terms of where people can get tested before I open up the forum to the community members to ask their questions directly, and so we can actually have a conversation between the community and the panelists?
If they want to get tested at the health department, they need to dial 336-641-7527. They will be asked a series of questions to determine if they are a candidate, and they will be tested regardless of their insurance.
Can you repeat that number again, please, Milagros?
Yes, 336-641-7527.
Okay, thank you so very much. So please,
welcome.
That number, and you will get the health department so you can get tested and know what your status is in terms of COVID and be able to take care of yourself and your community at the same time.
And if I can add, we have testing Monday to Friday from 9 a.m. to 12 noon, and then again in the evening from 1 to 6 o'clock in the afternoon in Greensboro. In High Point, we have testing from 3 to 7, Monday to Friday, and then on Saturdays from 10 to 3 p.m.
Thank you so very much. We appreciate that.
You're
Now,
welcome.
I could just mention, if you have access to a computer, if you go to www.healthyguilford.com, you will see all the listings where people can get tested. And many of the testing sites are free, as Milagros mentioned. So just check out the testing sites, and whichever one is more convenient for you, just go ahead and get tested. And there will be 2 large testing events, free testing events in December. December the 18th.
You said www.healthyguilford.com.
Yes, December 18th, December 30th, and January 6th at the Greensboro Coliseum. This will be a large testing opportunity for people who, again, may want to test before they travel. I'm not recommending traveling, but if you do travel, it's something to consider to get tested. And to get tested again when you come, because the incubation period for this virus is from 5 to 14 days.
thank you, Dr. Bay, once again for your input in this important discussion. As you've heard from the panelists, the experts, they have gone ahead and demystified COVID-19 for us in terms of what it's like from the medical perspective, in terms of, the HR perspective, what will happen to your job if you're tested and you actually test positive? What will happen to you, so that you are able to take care of your family and support your family during that time? And we also heard from COVID-19 survivors as well, who are still with us here today. Now, I know a couple of community members had questions for the panel. We are going to start off with Isa Abuzweda. Isa Abuzweda is also part of the board, and he has some questions to ask briefly. And the rest of the community members on this Zoom forum today will also have an opportunity to talk to the panel and get their concerns addressed. Thank you very much.
Hello, everybody. My name is Isa Abu Zaiter. I'm a board member, and I'm one community leader in the Muslim community also. My question is, how safe is the vaccine? Because right now, as far as I know, people like me and my wife, because we get allergies, medicine allergy and food allergies, we cannot take that vaccine. My second question, what the projection for this evil virus, how long will it stay with us? And how long the vaccine is effective for? Thank you very much.
Dr. Bay, would you care to address those questions for us? I think that is your area of expertise. And if you can unmute, that mute button is somewhere there.
Yeah, I think I found it. There's a lot of questions there, sir. The vaccine has been recently approved. I think it was approved, but it's approved under something called emergency use approval. So we're still studying the safety profile for this vaccine. So even though the vaccine may be available, and it's going to be available limitedly for healthcare workers, the first rollout, people in the health community that take care of COVID positive patients, they will be the first priority for the vaccine. And what we have to understand is that we don't have all of the information about the safety profile for this vaccine. So the more people who become vaccinated, and that we're going to learn more and more and more. But right now, it seems that from the individuals, the patients that did participate in the trial, we have information about that safety profile up to that point, and the safety and efficacy, meaning that it seems to be over 90% efficacious at this time. And so in the UK, where they first have already started vaccinating people, they did have one case of someone that had a severe allergic reaction. And this particular person was someone who had had a severe allergic reaction to medication in the past. So yes, if you're somebody who has had that type of history, you should have a very long discussion with a healthcare provider who treats you and knows your history and knows what kind of reaction you had. And they may say you are not the candidate to get the vaccine. If you're somebody who walks around with an EpiPen, you may want to reconsider getting the vaccine. But I wouldn't try to self-diagnose. Try to have this discussion in consultation with your trusted healthcare person before getting the vaccine. If you do have concerns surrounding allergies that you have, peanut allergies, egg allergies, you may not be that person to get the vaccine. Did I cover all your questions, sir?
Yes, ma'am, exactly, because we have the EpiPen, and that's what I was told. You're not a candidate right now unless they do something.
Unless when we learn more about it, that's gonna then it may change. But right now, you can still social distance. You should still wash your hands as much as you can, and most importantly, wear a face cover.
We do. Even when my kids come, they're social distance.
Excellent.
Thank you, Dr. Bay, for responding to that question that Issa Buzweda had for you. This is the time for the community members to work together, the entire community, because, this is something that if we are not very careful, we would live with this for a very, very, very long time. And if we're not accepting the vaccine or accepting the safety measures put in place, it affects us so much more, and it will continue on. It will be a lasting effect on all of us. So I am hoping that the vaccine works. I know a lot of people have some questions. I saw a very interesting question in the chat room just now, but we're going to go in the order that questions were received. And I believe Louise, if Louise is still on with us, Louise Farfan, you had a question for us. Are you still here? Okay, we will skip Louise. Erin, I know you're with us right now. Would you care to answer your question? Ask your question? Erin, please go ahead and unmute and start your video so that we can hear from you.
Hello, everyone. Thank you for this great meeting. It was a lot of great information. As it was mentioned previously, I'm a COVID tracer for Mustard Seed. And one of the issues that I have encountered recently is finding resources or connection to kind of, I don't know if there's any way to kind of force or convince an employer to pay an undocumented employee of theirs. Sadly, this person has COVID and is going through a really difficult time. It's been out of work for a month, but the employer is refusing to pay anything at all. And now, we're in this situation where it was mentioned before, one of the obstacles, for people to stay in the house or be quarantined is how do I pay the rent? So I'm trying to connect them with other resources, but I was just asking if there's any information or anyone that knows of anything. I know it's very complex because it's an undocumented person. But that was pretty much it. You know, I just wanted to know if anyone has any verses. I know some people posted some things on the messages, and I took note of it, and I'll share it and do more further research on that and connections. But if anybody else has encountered a similar situation, I'll greatly appreciate anything.
Thank you, Erin. I believe that is Roblin's forte. Roblin, I don't know if you want to reach out to Erin, you know, privately and talk to her later in the future, or you respond here, but she seems to be asking about a specific case and a specific person. I'm not sure if you're prepared to respond to that now.
Right. I would probably prefer to reach out to her and talk with her personally. That would be great.
Thank you so much. So Erin, Roblin's contact information is in the chat room. Try to just send her a message later on so she can see how she can help you, being that she's an HR professional. The next person that we have on Fanta, I don't see that list in our chat room. The next person that has to ask a question, I believe, is Bubakar Jeng. Bubakar Jeng and Baby Haj. It seems that you guys have questions for us.
Yes, thank you very much, Madam Franca Jalloh. We really appreciate you having us in this educated meeting. Yeah. Who's that? Hello?
Go ahead and ask.
Yes, I'm really sorry. I just had somebody singing. Yeah, my question is, first of all, we've been privileged to be in the company of these learned doctors and the people of your community. We give our hearts to you guys. My question to you here is, what are some of the sociological and psychological effects of being affected by this disease? What are the stigmas that are associated to the affection of this disease? Because let's say if somebody get tested and the result comes back that the person is positive, sometimes people are even scared to go close to them. So is it true that after getting this disease and being healed, you'll be immune to the disease, or that is just fallacy? This is my question to the doctors. Thank you very much.
Thank you, Bubakar. Dr. Bey, it seems that this is your area of expertise. So would you care to respond to Bubakar for us? Thank you.
I'm sorry, I didn't hear the last part of the question. Was the question, can you repeat this question for me? Just the last part.
And you unmute?
Oh, sorry. Yes, I'm sorry about that. The last part of it, what, like we've heard that when people got affected, there is a possibility that they will be immunized. They become immune to the disease. So my question is this a fallacy or is this reality? Because sometimes you have some psychological effects of being affected by the disease.
Okay, right now we're still learning about the effect of being coronavirus positive. So we cannot tell you today, and we don't make any guidelines surrounding people who have been previously infected with COVID-19. So to say that you are immune because you have been infected, there's no good data to support that. You know, it may be something that we'll learn because, again, we keep learning more and more about this virus. But right now, we can't say. But if you have been COVID positive in less than 30 days, it's not recommended that you get the vaccine if it's offered. But the vaccine, again, probably for general population consumption won't be available until later on in 2021 right now. So because you've had the virus, that does not mean that you shouldn't wash your hands, that you don't need to wear a face mask. And that means that doesn't mean you shouldn't social distance. That's what we can say based on the amount of knowledge that we have about the virus. Not right now, we don't have a lot of information about how much immunity you have because you were infected. How long does that immunity last because you were infected? We don't really know that information right now. But as we go through this, we step through this whole process with this pandemic, we will be learning more and more information.
Thank you, Dr. Bay. I believe the next person who had a question to ask was Nene. Nene, please go ahead and ask your question. Nene, are you still with us? You can unmute. Fanta, do you mind reading out Nene's question? I know she put it in the chat. She's probably
Sure. The question was around the vaccine. Apparently there was some information that was given to them that the vaccine has a possibility of causing HIV. Essentially, it was indicated to be a false positive about HIV. So what is a reliable source of information to read about the vaccine and its efficacy?
I believe, Dr. Bay, that's for you as well. It seems that they're linking the vaccine and COVID-19 to HIV. Did you get that question from Fanta?
Yeah, I heard that. And I was looking in the chat. I also saw that there is no evidence that getting the vaccine causes HIV. So to this point, in the rollout of vaccine with the information that we have learned from the trials for the efficacy and safety of it, it has not been associated with HIV. And if that is something that is true, there are a lot of guardrails that are in place now surrounding drug development and vaccine development. And that's not something that has been revealed to my knowledge. So again, if you're a person that is looking for information, the CDC website is a good place that you can look for information. And usually the information may be a little complex, but they do have segments in the website that address frequently asked questions, and they do sort of simplify, and they become very straightforward with a lot of the myths to help debunk them with actual facts. There is no factual reasoning right now. I have not heard of it. I have not read it that says that getting the vaccine causes HIV.
Thank you, Dr. Bay. Thank you so much. I believe the next person who has a question is Damie. Damie, please go ahead and unmute yourself so you can ask the question. Thank you.
Good evening. Thank you so much. I have two questions. My first question has to do with, I understand if the local hospitals begin to become overwhelmed with COVID patients, that they will begin to triage. And my question is there any education being done with health providers around how to lessen discrimination based on who presents at the hospital with COVID symptoms? And my fear is that immigrant communities will it'll be worsened for them to go to the hospital because of fear of being discriminated, that they will not be admitted to the hospital, especially if we're at capacity. My second question has more to do with HR policy. Is there anyone or any body that is looking at the policies of companies that have accepted federal dollars that are not implementing or have set up policies that de-incentivize employees to say, oh, I have a family member that has COVID, or because I'm finding that some of the policies don't encourage people, even though they've gotten federal dollars, some of the policies do not encourage people to test if they believe they should test in fear of not having a job to come back to, or if a family member has COVID, you know, that they may not also be tested in fear of if they test positive, then the other person cannot go to work. So I'm just wondering around those two things.
Thank you. I think those are excellent questions. I'm not sure if Milagros or Dr. Bay or any of our health experts can respond to Dami's first question.
Well,
Okay, I'm gonna respond to the first question. As being the limited English proficiency multi-services coordinator for the health department, the hospitals cannot discriminate based on your race, color, origin, faith, or the color of your skin, for the simple fact that they fall under the Title VI Civil Acts right, which prohibits them from doing any type of discrimination. They cannot even discriminate you because of your inability to pay. So the same thing goes like when you come into the health department, you make an appointment, you get seen, you get treated, regardless of your status, regardless of your economic status. We are here to serve the community. Dr. Bates, you want to add to that?
Yeah, I just wanted to add that's very true. And so in this country that we have situations where certain groups are looked at certain ways, and we have to be very careful about our equity lens when we're evaluating situations. However, just like have a plan for if you become COVID positive, have a plan for if you go to the hospital and understand some of your rights, because hospitals cannot turn you away. They must treat you. But on the other hand, what we're advocating right now, and the whole reason for the forum, is to really arm ourselves how we can stay out of the hospital, how we can stay safe, how we can keep our families and our communities safe from this virus. At this point in the history of this country, there has been systemic racism, there has been inequities, and so we just have to continue with our knowledge and our understanding of our rights. We got to continue to fight. But for the COVID situation, we can do our part and keeping ourselves safe to make sure that we don't have to present to hospitals, because when we are having so many positive cases, and people are severely affected by it, that is what is going to meet the capacity of hospitals. And there's only so much that you can do when you reach that capacity. So we have to stay safe. We have to wear our masks. We have to social distance. We have to wash our hands.
Thank you, Dr. Bay. Does anybody else have something to add to that response? I believe Fanta wanted to say something as well.
Yes, well, I just wanted to make sure that everyone knows that it is not the hospital's policy to discriminate. That would be a personal doctor thing if it ever happens. Like Dr. Bay says, their entire policy is definitely to help whomever comes before them to get help. I've seen countless nurses, tirelessly working overtime to help with the overflow that's happening. So definitely, if you go to the hospital, make sure that it is because you seriously know that there's something going on, and not not something that you can maybe cure at home. A lot of people are taking up, beds because they feel, a little sick. So, just try to distinguish whether it's having allergies versus something a little more, because there are a lot of beds definitely being taken up for that. But I also wanted to bring light to Dami's other question that she asked in the chat about the children. I didn't know if someone can address that. How are the children symptoms and things being tracked, and what are if things are being done differently for children than adults?
Would anyone care to answer to that question? In terms of, I guess Demi had a second or third question in terms of how are children being treated compared to adults.
I could try to answer that, but I'm not sure I understand the question. When you say children treated differently than adults because of...
The question had more to do with positivity rates. Is there any data being collected on the population and positivity rates among children? Especially since we know that the immunization, what they're talking around implementation is going to start at the age of 16 as well. So I'm just curious to know if that information is being tracked and any implications of that.
Yes. Dr. Bay, if you permit me, if you allow me to answer that part. Yes, if you go to www.healthygifford.com, you will see all of the graphs which are listing information by age, race, gender, and you could see how it's being tracked. You can see day by day how the number either increases or decreases. The information is constantly being updated every day so that the community, the public, is aware of how this COVID-19 is affecting Guilford County as a whole.
Thank you, Milagros. Thank you so very much. The next question is comes from Bubakar Jeng. Bubakar, and I believe Baby Haj has another question for the panel. And if anyone else has a question, please feel free to just put your name there in the chat or raise your hand remotely so that we know you have a question for the panel. Thank you.
Hi, thank you, Madam Franca. It's actually Baby Hajen. It's not a question per se. I'm also a healthcare. I'm a nurse. I work in a critical care here in Columbus, Ohio. Unfortunately, I can't answer for Greenboroughs in North Carolina, but I can say I work with COVID patients almost every day, working my 3-4 days at a hospital. And I've just recently been sick. I listened to all the panel. I just want to put my input in it when it comes to the immigrants people. I think like the previous speaker says that immigrant people and the stigma, like I think it was Madam Franca, the stigma about COVID, we can help educate our people. I live at home with my children and husband. And every day when this COVID started, I started doing other things like the cultural things. But then I realized maybe this is not gonna work. So I start having them, every day I come up with a topic, I deliberately bring up the COVID talk so I can help protect them from whatever I'm bringing at home. Maybe my immune system is stronger, like the doctor said, and I probably may be a carrier. As you can hear me talking right now, I don't have COVID, but I went through this stress about a couple of days ago at work. And I think it's like a pneumonia that almost collapsed my lungs. I don't even think most of my community people don't know, but that the first thing that the hospital was doing was trying to triage me and see if I have COVID. It's not a funny thing. It's COVID is real. I thank God I don't have COVID. I was not worried about me. I was worried about my family, because I thought I was already falling down. That's the first thing that crossed my mind. I just want to plead to my people that are listening, please wear your gloves, wear your mask, wash your hands, wear gloves if you have to, and protect your loved ones. It's not easy. I just want to put my 2 cents in it, and so you guys can hear it from an immigrant employee. Trust me, every day, we are emotional people. I used to come home and cry in the garage in my car before I hit my family. And I look at my husband, he's very young. I say, you know, this thing is it kills. It kills a lot it doesn't discriminate. When I lost the 32-year-old, that was a kicker for me in my hands. When I came home that night, I'm like, I don't know what to tell my family, but my kids used to say it doesn't kill young people. I said, no, 32-year-old died in my hands in critical care. I said, this is serious. Where do I start with my family? But you can get them to that point. I see my kids wearing masks. Before it was not easy. The first phase was hard. This second one is not too difficult because people are used to wearing the mask. The only thing that we are asking for is to continue. Don't just wear it for fashion. Wear the mask and cover your nose and try to protect the other people. We immigrants, we're very strong people. Our immune system are very strong. We might be carriers, but you might not get the symptoms ever, or you might kill somebody that you love dearly close by you. I just want to say that. Thank you for giving me this panel, Madam Franca.
Thank you so much, Madam Baby Haj. I think you just addressed some of the concerns and fears and things that we are thinking as immigrants. You know, what does it feel like as a healthcare worker? You are one on a daily basis. You're out there in the field, literally dealing with patients with COVID. You're in the COVID units and you see people pass away, die, you know, almost on a daily basis. And for you to share this with us, it's very powerful. We're very touched by it. And I hope our people are listening and taking this seriously, that, you know, we need to care for our own well-being and our communities because people can die from it. A lot of people did not die, but there's a possibility. And we need to contain this as soon as possible before it gets worse. Thank you so much, Baby Haj, for sharing your story with us. Next, I believe Commissioner Musa Isifu has a question or a concern or a statement. He just raised his hand. Musa Isifu, please go ahead and ask your question. Thank you.
Yeah, thank you everyone for this very informative evening. Particularly our doctors, thank you so much for your service in the communities. Thank you so much for informing us and educating us about this very dangerous virus. Yeah, I have just an announcement, not a question. Tomorrow at the Islamic Center of Greensboro, located at 2023rd 16th Street, we will have a free COVID testing offered by the Guilford County Health Department. So please, you can, feel free to drop by and get tested. It's going to be free, and it will be there between 10 a.m. and 2 p.m. This is a wonderful opportunity open to everybody that is going to be at the Islamic Center of Greensboro from 10 to 2. The address is 2023rd 16th Street, Greensboro, North Carolina. Thank you so much.
Thank you. You just heard from Commissioner Musa Isifu, who is also the chair of Greensboro African Public Action Committee. He has announced that there's free testing tomorrow at the Masjid, the Islamic Center in Greensboro. Please go ahead and get tested. If anyone else has resources or information to share, please feel free to do so at this time. Do we have another question from our community members? If you have a question, please unmute, go ahead and ask. Or if you have a statement or a concern that you want to raise, please feel free to unmute and ask at this time. Okay.
Can I make an announcement, another announcement?
Sure, Sadiqa, go ahead.
Yeah, COVID-19 also affected people economically, and people strive for food. So next Friday at 4 p.m. also we have a food drive for everybody to drop at the same place, 2023 at the Islamic Center of Greensboro. And this is sponsored by the Ka Foundation of America and like many organizations, the Islamic Center of Greensboro, the group called Integration Working Group, my new organization, Giving Hands US, and many other organizations. So please share this word with people and they can come and have their box of fresh food. Thank you so much.
What time is it?
At 4 p.m.
So
can I just make a correction? The health department is not testing at the masjid. It's Old North State Medical Center Society. Sorry.
Thank you, Dr. Bay, for that correction. So Jallohs Upright Services also received several we received several donations from Piedmont Business Capital, also from Cone Health. We have lots of PPE, including, masks, gloves, detergent, Clorox, cleaning supplies, and so on. Please feel free to reach out to us to get some supplies. We will be distributing it on the 22nd, I believe, or the 23rd of December, along with gifts for the community. We received a lot of gifts from an anonymous donor, and we are going to be distributing all those Christmas gifts to our community because they feel that this is a difficult time for everyone. And so having these special gifts, items that people need and want being given to them for free is important. And they chose Jallohs Upright Services to help distribute these gifts out to the community members, including laptops, you name it. A lot of materials were given to us. So please reach out to us. And next week, on the 22nd, we will be doing a gifts giveaway, as well as also distributing the PPE that we received. Thank you all so much. Commissioner Musa Isifu, I think you have another question.
I was going to ask, I think it is Dr. Bay, the one who just brought the new information about the testing. I don't know, we've announced this at the masjid today. We sent out messages because we've been, our sisters committee worked with the health department for this event. Maybe either you cancel the event without us knowing, or it is another event, different event that you are mentioning here. If not, we're sure that we are hosting the health department tomorrow. This is what we haven't received any contradictory information as of now. So I don't know which one you're referring to.
Well, it's possible, Commissioner Musa Isifu, that Dr. Bay is talking about another event somewhere else.
It is possible because
maybe a different event that you have organized. But Dr. Bay can, chime in. It seems that he has, there's one event at the masjid, and there might be another one somewhere else that you just mentioned. Yeah. Would you care to address that?
I don't have knowledge that the health department is doing COVID testing tomorrow at a masjid. I know we have immunization clinic, but I'm just saying.
Yeah, maybe there was some miscommunication somewhere. I don't know, but we even have flyers going around. You will see our flyers on Facebook everywhere since yesterday or the day before yesterday. So this, I'm not sure, maybe there is a change, a last minute change or something, but yeah, I don't know. I cannot, since Dr. Bay is from the department, she might be well indicated to say something about it. So, but yeah, this is the impression we had.
Commissioner Isifu, like I said, possibly there may be another event. Yeah. So please feel free to reach out to the health department, the person who coordinated that event.
Yeah, we will do that.
Dr. Bay has also given us a valuable resource that there's another event possibly. And so the community members, should know this other information as well. So thank you, Guilford County Health Department, for always doing the best you can, reaching out to our community members and making sure that we're all kept safe and informed at all times by sending wonderful panelists to come out and talk to us, like Dr. Bay and like Milagros Amaro, who is also a part of the Guilford County Health Department. I want to take this moment to thank all our panelists who took the time to join us today and answer all these questions. Thank you so much to each and every one of you. You have given us more so a world of resources and information that is more valuable than money. So thank you for your knowledge. Thank you for your time. Thank you for your willingness to share. We appreciate each and every one of you. I also want to take the moment to thank our guests. You know, without you, this would not be possible. You guys care about the community. You're here to learn more and do the best you can so that we can move forward as a community and make Greensboro and make North Carolina and make the United States and make Africa and the world a much better place to live. Thanks for taking your time to join us here today. I know we have someone all the way from the United Kingdom, from England, who has joined us. Augusta Koroma is actually joining us from London. And she's on mute. I don't know if she has any questions or concern, but I see her on the screen, and that is someone all the way from England. We are reaching far too, people near and far. You have reached someone all the way from England, and who else is watching on Facebook, because this is streamed live. Your information, the information that you shared, has touched so many lives today. So one for your time and your expertise. I believe Issa Buzweda would like to say something.
Yeah, sorry, but I just want to remind everybody we are on the stay-home order from 10 o'clock to 5 o'clock in the morning. So please obey by the order, by the governor of North Carolina. You cannot come out unless it's emergency. From 10 o'clock to 5 o'clock in the morning. Thank you very much.
Thank you for sharing that. That is actually a very important thing to share. It was one of the things that I believe Dr. Bey and myself were going to say at the very last moment, but you beat us to it, and we are grateful to you, Issa Buzweda. We're grateful to you and to Mary Kay Buzweda for everything you keep on sharing from the city of Greensboro. Does anybody have any last comments or concerns or statements? Well, on that note, we are going to adjourn this panel discussion. We are going to end with a spirit of festivities, but on a different note this year. We are not going to be celebrating Christmas and the New Year's like we are used to. These are different times. These are dangerous times. And Issa Buzweda just mentioned that there's a stay-at-home order. A lot of people on this panel today have talked about the dangers of COVID-19. I hope each and every one of you has heard what has been said today, and will take that very seriously. COVID is here and it is real. We need to keep ourselves and our families safe. So please enjoy your Christmas and your New Year's, but do it in a safe and a great way, so that a memorable way, without affecting everybody else around you and continue to spread this deadly virus. Thank you so very much, each and every one of you, and have a good night. Merry Christmas and Happy New Year in advance. Thank you.
Thank you, Frank.
Thank you very much. Good night.
Thank you.
Good
Thank you,
night.
everybody.
Be safe.
Night.
Very helpful.